Every single hour of every single day, one person in the United States dies from oral cancer. This isn't just a statistic, it's a call to action, because the profile of who's at risk is changing faster than ever. This video is your definitive guide to understanding the signs, the real causes, and the truth about recurrence, so you can turn knowledge into power. To understand how we can protect ourselves from that staggering number, we have to journey to the very beginning. We have to understand how a single, healthy cell can go rogue. Chapter 1: Rogue Cell. Before we can speak of a tumor or a symptom, we must go to the beginning. Imagine the lining of your mouth is a perfectly tiled floor made of millions of flat, protective cells called squamous cells. This floor endures a lot: hot coffee, crunchy food, constant friction. To cope, these tiles are constantly being replaced in a perfectly organized, controlled process. Oral cancer, in over 90% of cases, is a squamous cell carcinoma. This is a technical name for a simple event. One of these cellular tiles develops a catastrophic error in its genetic blueprint, its DNA. This error tells the cell to abandon its normal duties and to do only one thing: multiply. It ignores the signals from its neighbors to stop growing, creating a disorganized, chaotic pile of rogue cells where there was once order. This pile is a tumor. It starts invisibly, microscopically, but with time, it will grow, and it will begin to send signals. Our job is to learn how to listen for them. Chapter 2: Your body's clues. The clues your body provides are often quiet whispers, not screams. That's why we must become detectives of our own health. The signs can be grouped into 3 categories. First are the visual clues. This is what you can see in a mirror. The most famous clue is a sore or ulcer that simply refuses to heal after 2 weeks. But equally important are changes in color and texture. Look for persistent white patches, which doctors call leukoplakia. Think of this as a cellular callus, a thickened area the body creates in response to irritation, but one that can sometimes harbor abnormal cells. Also look for red velvety patches, called erythroplakia. These are often more serious, as their red color indicates a rich blood supply, which can feed growing tumors. Second are the sensory clues. This is what you can feel. You might notice a new numbness or a strange tingling sensation in your tongue, lip, or cheek. This is a profound clue. It suggests that a growing tumor might be pressing on, or even beginning to invade, one of the tiny nerves that give your mouth sensation. Another sensory clue is pain, but not always. Early oral cancer is often completely painless. If pain does develop, it might be a dull, persistent ache in your jaw, or even a referred pain felt as an earache on one side, as the nerves of the throat and ear are linked. Finally, there are the functional clues. This is a change in how your mouth works. You might suddenly find it difficult to chew, or find yourself stumbling over words because your tongue feels thick or clumsy. Swallowing might become painful or feel as though something is constantly stuck in your throat. You might notice your jaw feels stiff, limiting how wide you can open your mouth. These aren't just random annoyances. They are signs that a physical mass is beginning to interfere with the intricate mechanics of eating and speaking. Chapter 3: Risk Factors. What writes the errors into our cells' DNA? The causes are a mix of lifestyle, environment, and biology. For decades, the primary architects were tobacco and alcohol. Tobacco contains over 70 known carcinogens, chemicals that directly assault and mutate cellular DNA. Alcohol acts as a powerful accomplice. It doesn't just damage cells on its own. It acts as a solvent, making the tissues of the mouth more permeable and allowing tobacco's carcinogens to flood in more easily. This creates a dangerous situation that scientists call field cancerization. In simple terms, this means the alcohol and tobacco don't just injure one spot, they damage the entire field of cells, making the soil of your mouth fertile for cancer to grow almost anywhere. But now, there is a new architect, one that has changed everything: the human papillomavirus, or HPV. Specifically, the HPV-16 strain. This virus performs a terrifyingly precise act of biological sabotage. It inserts its own genetic code into your cells and produces 2 biological sabotage agents, proteins known to scientists as E6 and E7. Think of your cells as having 2 critical alarm systems that prevent cancer. These viral proteins do one thing: They hunt down and dismantle those alarm systems, leaving the cell completely defenseless and open for a hostile takeover. This is why HPV-positive cancers are now the leading cause of cancers in the back of the throat, and they often occur in younger, non-smoking individuals. Chapter 4. Suspicion to certainty. Let's say you've noticed a persistent clue. What happens next? This journey can be frightening, so let's walk through it. It usually begins with a visit to your dentist or doctor. If they see an area of concern, they will refer you to a specialist, typically an ear, nose, and throat surgeon, or an oral and maxillofacial surgeon. This specialist will perform a thorough exam, and then, to get a definitive answer, they will perform a biopsy. This word sounds intimidating, but it's a simple, crucial procedure where a tiny piece of the suspicious tissue is removed and sent to a lab. There, a pathologist, a doctor who specializes in diagnosing diseases by looking at cells, will examine it under a microscope. This is the only way to know for sure if cancer is present. It is the absolute gold standard. If the diagnosis is cancer, the next step is staging. This is the process of determining how large the cancer is and how far it has spread. Doctors use a simple system called TNM. T for the size of the initial tumor, N for whether it has spread to nearby lymph nodes in the neck, and M for whether it has metastasized or spread to distant parts of the body. Staging is critical, as it provides the roadmap that will guide your entire treatment plan. Chapter 5. Recurrence. For those who have walked the path of treatment and emerged on the other side, a new shadow can appear, the fear of recurrence. To disarm this fear, we must understand it intimately. A recurrence is the return of the original cancer after a period of remission. It happens because a small number of cancer cells, undetectable by any scan, survived the initial treatment. This is called microscopic residual disease. These surviving cells are often the toughest of the tough. Some may be cancer stem cells, the master cells of the tumor, which have unique defenses that allow them to resist chemotherapy and radiation. They can lie dormant for years, waiting for the right conditions to reawaken and rebuild the tumor. Recurrence can be local, returning in the same spot, regional, appearing in the lymph nodes of the neck, or distant, spreading to organs like the lungs. It is most likely to occur within the first 2 to 3 years after treatment, which is why the follow-up period, known as surveillance, is so intensely monitored with regular checkups and scans. The anxiety before each of these scans is so common among survivors it has a name, scanxiety. It is a testament to the heavy psychological burden of survivorship. Chapter 6. The modern arsenal of hope. If an initial cancer or a recurrence is found, the fight today is waged with an arsenal of precise and powerful weapons. Surgery and radiation remain cornerstones. Surgeons work to remove the tumor with clear margins, meaning a border of healthy tissue, while advanced radiation techniques like IMRT can sculpt beams of energy to attack the cancer while sparing surrounding healthy tissue. But the true revolution is happening in systemic therapies, medicines that fight cancer throughout the body. Beyond traditional chemotherapy, we now have immunotherapy. This is not a drug that kills cancer. It is a drug that unshackles your own immune system. It blocks the signals that cancer cells use to hide, effectively ripping off their invisibility cloak and allowing your body's own killer T cells to see and destroy them. We also have targeted therapy. If chemotherapy is a carpet bomb, targeted therapy is a smart bomb. These drugs are designed to attack a specific vulnerability, a specific mutation found only in the cancer cells. It is the ultimate form of personalized medicine, attacking the very engine that makes the cancer grow. Let's bring our journey to a close. We became detectives, learning the visual, sensory, and functional clues our bodies provide. We uncovered the complex motivations of the disease, from the damaged field caused by tobacco and alcohol to the molecular sabotage of HPV. We walked the clinical path from a simple biopsy to the complexities of staging, and we stared into the survivor's shadow of recurrence, finding understanding instead of dread. Finally, we surveyed the modern arsenal of hope, a testament to how far science has come. The promise of this video was to arm you with a profound level of understanding. That knowledge is now yours. It empowers you to be vigilant, to ask the right questions, and to be an active, confident advocate for your own health or the health of someone you love. Thank you for taking this deep dive with us. If this masterclass has provided you with value, Please subscribe for more content that respects your intelligence and empowers your life. What part of this deep dive was the most eye-opening for you? Share your thoughts in the comments below. Your insights help our community learn and grow together. Be vigilant and be well.